And thanks everybody for joining us. You know, it's been a rough month and a half. The Delta surge has really been stressful. It's overwhelmed our health system and it's caused a lot of unnecessary deaths. Fortunately, we are starting to see an inflection point with somewhat of a decline in hospitalizations and daily cases, but we're seeing a pretty significant number of daily deaths, which we know do lag cases. And we're still logging thousands of deaths a day, of cases a day. And so we're still in the thick of the Delta surge. Sadly, we've seen a pretty significant number of pregnant women not survive COVID in recent weeks. Currently, we're investigating 8 reports of pregnant women who have died within the past several weeks, all of whom are unvaccinated. We do know that COVID is especially problematic and dangerous for pregnant women, but we also know it can be deadly for the baby in the womb. With COVID, we've seen a doubling of the rate of fetal demise or the death of the baby in the womb after 20 weeks. It's been a real tragedy. Um, Please know that the vaccine is very helpful and can remarkably successful at preventing these severe outcomes in pregnant women. So we really want to make sure that we're making an effort to get pregnant women protected, to get pregnant women vaccinated. Expect to see more information coming out from us and with our partners to make sure we are protecting some of the most vulnerable people within our population. Additionally, if pregnant women do get COVID, they do also need to pursue monoclonal antibodies. So if you're pregnant and if you get COVID, please go ahead and check into getting monoclonal antibodies. Vaccines and antibodies are approved and recommended for pregnant women. Please know CDC, the Society for Maternal Fetal Medicine, and the American College of OBGYNs strongly support vaccination for pregnant women. This is something we can do to save multiple lives at one time. Um, Moving on to the concept of vaccinations, we are seeing ongoing success in our vaccination effort. We have almost 1.5 million people, almost half of the state has received at least one dose. So we are making some progress. We had over 50,000 doses of vaccine given last week, but we don't have near enough people in the state who are immune, either because of natural infection or because of vaccination to keep us from having additional surges or to keep us from having additional outbreaks. So please, if you are not immune, if you've not been vaccinated, please go ahead and get vaccinated. We know it's extremely safe, it's extremely effective, and we're seeing more and more data that shows us how incredibly safe it is. And we still know that the vast majority of our cases, hospitalization, and deaths are among those who are unvaccinated. Please keep in mind that although vaccination is our plan A, we know that's the best way to protect yourself. If in fact that you do get COVID, please explore, talk to your doctor, go to our website, msdh.ms.gov/MAB, call the hotline, and check into getting monoclonal antibody treatment. We know it's extremely effective, 80 to 90% at preventing hospitalization. It saves lives. And right now we have a statewide standing order such that you don't have to have a doctor's order to get monoclonal antibodies if you have COVID. So please, if you have COVID, go to our website or call the hotline. We have over 180 locations around the state, and a large number of those take direct referrals where you can come in and get monoclonal antibody treatment. We're very happy that additional types of monoclonal antibodies are now available. The bamlanivimab, etesevimab, or one that we used a lot earlier that was not effective against Alpha variant is very effective against Delta. So we have additional tools available in our armamentarium to fight against COVID. Liz, I'll turn it over to you at this time. Thank you.
Thank you so much, Dr. Dobbs. State epidemiologist, Dr. Paul Byers. Sadly, we are reporting another pediatric death. So why don't we start with that?
Yeah, thank you, Liz, and thank you, Dr. Dobbs, as well. have reported, and we are reporting an additional pediatric death. This is in a child less than a year of age. Today, we're reporting out over 1,900 additional cases, but over 100 additional deaths. And like I said, sadly, one of those deaths is in a child. That brings us up to 7 pediatric deaths that have been reported so far during this pandemic, dating back to our first cases and deaths back in March 2020. But when you look at our data for the number of cases that we are reporting, we are beginning to, like Dr. Dobbs said, have an inflection point. 1,900 cases today. When you look at our cases that we're reporting out from week to week, we are starting to see some stabilization, but not so much in the deaths. We are still seeing increased numbers of deaths. We anticipate that we're going to see that for a short time. When you have a very large surge of cases like we've had, sadly, the deaths follow 10 days to a couple of weeks after that. And so we may continue to see elevated numbers of deaths for a while longer now. We're not out of the woods yet. When you look at our cases and deaths that we had reported in August alone, we had over 93,000 cases to date reported in August. And we're not finished with August. Some of the cases that are being reported now still have dates that occurred in that August timeframe. So that number may increase. When we look at the number of deaths that we had reported in August, it's over 1,000 deaths now. And sadly, that number may grow as well as additional deaths are reported. And again, you know, the overwhelming majority of the cases and hospitalizations that we're seeing and the deaths that we're seeing are sadly in unvaccinated individuals. And remember that, you know, we have children less than the age of 12 that are not eligible for vaccination yet. And so it's going to be important for us moving forward to make sure that we keep those children as safe as possible. Certainly vaccination of those adults and those eligible members in the household is one of the best ways to keep the children safe. We'll talk a little bit more in a moment about some of the best practices in the school settings. But again, as Dr. Dobbs mentioned, we are starting to see some decreases in our number of confirmed cases that are in the hospital. This is encouraging, but they're still at very high levels. We're still reporting out today over 1,300 cases that are confirmed and hospitalized. And so those are high numbers compared to where we were at our previous high over the winter surge. Still over 400 individuals who were in the ICU due to COVID. Still over 300 individuals who were on the ventilator due to COVID. And unfortunately, we are seeing you know, an increased proportion of our cases in the hospital that are pediatric cases. And you know, we've seen a recent increase in August and September, again, of our pediatric hospitalizations. And, you know, at last count, just a few days ago, we had 24 pediatric cases in the hospital. And so this continues to be a concern moving forward. One of the bright spots is the impact in our school settings. Now, we've worked very hard over the last several months to provide our schools in Mississippi with the support that they need, the guidance that they need, access to testing and access to vaccinations, as well as you know, giving them the best guidance we can to try to prevent transmission within the school setting. With over 800 schools reporting out for last week, on our most current report, we've seen a decline in the number of teachers and students and staff that are on quarantine. For the week of August 30th through September 3rd, 15,000 students were on quarantine compared to more than 23,000 in the previous week and more than 28,000 in the week prior to that. And we've seen some decreases in the number of teachers that have required quarantine as well, dropping down to 570 with our last report. We've seen some drops in the number of cases as well in students and teachers and staff, and the number of outbreaks in those settings as well. And again, these are encouraging indicators that are expected as we continue to see our cases drop. We have over 50 schools and school districts in the state that have signed up to participate in the testing that are one of the phases that we have to offer. And over 5,000 tests have been conducted in the school setting so far. We have almost 100 schools and school districts that have signed up to be part of the vaccination effort. So the Adopt a School, actually, it's well over 100 now. 96 individual schools and an additional 26 school districts. And in those schools and school districts so far, over 1,100 vaccines have been given to school-age kids. And so these are the things that are going to be important to continue to keep our kids safe. And we've talked about this. MSDH has strongly recommended that there's universal masks in the K-12 settings indoors for all vaccinated and unvaccinated students, teachers, and staff. Participate in testing, do that screening testing to try to identify those cases early so that they can be excluded from the school setting, in fact, before we see transmission that occurs. And lastly, make sure that we're promoting vaccine as much as possible for those eligible students, teachers, and staff, and that we're facilitating it as best as possible. And that's what we're trying to do from the Department of Health. And we'll continue to work with those schools in those school settings. The last thing I'll talk about is we're continuing to get questions about ivermectin and ivermectin use for the treatment of COVID. I just want to be clear that the biggest thing that we're recommending from the Department of Health is if you test positive for COVID, consult with your physician. Get monoclonal antibodies if they're indicated. We have broad utilization across the state and broad availability across the state for monoclonal antibodies. As Dr. Dobbs indicated, monoclonal antibodies have been shown to decrease the risk of developing severe disease, hospitalization, and death. But what we do recommend is that, talk to your doctor if you're COVID positive as well. Take medications only that your doctor prescribed. Please don't go and take livestock medications, whether it's livestock ivermectin or other livestock medications. These medications are highly concentrated and they can be toxic for humans. And so please, that's the real message that we want to say about ivermectin is please consult your doctor, take medications prescribed by your doctor, and don't take medications that are indicated for livestock. And Liz, that's really all I have today. Thank y'all for the opportunity again to speak with y'all.
Dr. Byers, before I let you get away, let's talk a little bit. We've gotten some questions about the Mu variant that has been seen in many states. Can you give us an update on that?
I sure can. I think first we want to say that almost 100% of the strains of COVID that we're identifying in Mississippi right now are Delta. And it's been that way for a number of weeks. We've talked about the fact that Delta is very infectious. And right now, it is overwhelmingly the predominant strain in the United States and in Mississippi. Now, there have been some discussions about Mu lately. There's been discussions about Lambda lately. And these are other variants of COVID that have been identified. Now, in Mississippi, we have identified cases of Mu dating back to May of this year. 4 cases so far. I think one of the things that is important to remember is so far we have not seen wide transmission of this variant or really wide transmission of any other variants except for Delta. We know that Delta is, like I said, highly infectious. It's the strain that is predominant and is responsible for the cases, the hospitalizations, and the deaths that we're seeing in the state right now. But, it's important for us to continue our surveillance. We're going to continue to do our virologic surveillance to identify additional variants as they are reported out, and that we need to continue to look at them. And we'll continue to do investigation around those as well.
And Dr. Byers, did I hear you right that you said we have seen 4 cases identified as mu?
Yeah, dating back to May. And I think that that's an indication that that we have not seen significant spread of it in Mississippi, but we have identified some cases. And that's going to...
Go ahead, Dr. Byers.
No, ma'am, that's it. I think I'm done. Thank you.
All right, thank you so much for doing that. We continue to see a lack of ICU space in our hospitals. So let's start with that, Mr. Jim Craig, Senior Deputy and Director of Health Protection. Give us an update on the ICU situation.
Yeah, thanks, Liz. We are seeing some small improvements in hospital bed availability around the state, but our ICU bed availability continues to be very scarce. The COVID system of care still is active and mandatory for the hospitals in the state for transferring those critical care patients that can't be accommodated through the normal referral process. Our health officer order for the COVID system of care was renewed yesterday and is good through September 15th. The requirement for the delay of the Tier 1 and Tier 2 elective surgeries has been removed. So hospitals may resume Tier 1 and Tier 2 elective surgeries that lead to overnight hospital stays as space becomes available in our facilities. Since the COVID system of care was activated, Mississippi MedCom reports more than 2,127 patients have been transferred. You may have noticed that on our bed status reports on our websites, they're currently not active. Problems continue as the snapshots used for this report really don't reflect the dynamics of the system while the COVID system of care is active and space is limited. Hopefully we'll be on the backside of this wave soon. When we're not bedding patients in the emergency rooms anymore, we can resume our daily snapshot reporting. But as of 8 o'clock this morning, critical care hospitals reported 10 ICU beds available with 202 emergency room holds. When you look at these 202 being cared for in an emergency room bed, 67 patients are waiting for an ICU bed. Of those 67 that are waiting for an ICU bed, 23 of those are COVID patients. So if you look at that, the number of patients that are waiting on an ICU bed and being cared for very appropriately in emergency rooms, the bed capacity for ICU space is effectively zero still in the state of Mississippi. We have additional ICU capacity in some hospitals in the state. It could be used, but the problem remains of insufficient staffing to operate all of the beds. Again, with the governor's office in MEMA, they continue to, and our federal partners, we continue to get staffing agencies and others to help increase that ICU staffing so we can make those ICU beds available. So if we look on the federal front, yesterday we requested a 14-day extension of our federal partners at the VA to continue providing 5 ICU beds at the Jackson VA and 5 ICU beds down at the Biloxi VA for critical care rotation in the system of care. Our 23-person DoD team, our Department of Defense team, continues at UMMC, and we're waiting to hear back on our request to extend that team for an additional 30 days. We have a 7-person public health service team doing monoclonal antibody administration at the university, and we have requested that that team or a very similar resource be made available to the state to continue that mission. As an update, we'd like to thank Samaritan's Purse for coming to Mississippi and operating their field hospital over in Garage C at UMC. This dedicated team of physicians, caregivers help by providing much needed ICU care, step-down care, and decompression support for hospitals during the recent storm, as well as just hospital decompression in total around the state. Their mission has ended, and they are in the process of demobilizing the field hospital. Our 23-person Department of Defense team continues assisting with COVID patients up at North Mississippi Medical Center, and we're also waiting to hear back on our request to extend that team for 30 additional days. Our 10 2-person federal teams continue to assist in the administration of monoclonal antibodies around the state. They are, in addition to those existing resources, as Dr. Dobbs said, there are a number of places around the state providing monoclonal antibody treatment. We have requested an extension of our current teams and an additional 9 teams to assist with administration of monoclonal antibodies in Mississippi. Our EMS services in Mississippi remain stretched thin to cover 911 calls and patient transfers. EMS services continue to report long wait times in hospitals as well as distant transfers, both of which are impacting their availability of local units to respond to 911 calls. Ambulance services also report sufficient number of trucks or ambulances, but they lack enough staffing. We did request additional EMS resources to help with this from FEMA, and last week we received 2 advanced life support strike teams to assist with critical care transfers. Each strike team is comprised of 5 advanced life support ambulances, and these units are being tasked through the COVID system of care by the Mississippi MedCom. Again, staffing for our hospitals remains a critical need around the state, especially to free up and open up ICU spaces. Working with the governor and MEMA, physicians, the critical care nurses, nurse practitioners, respiratory techs, and others continue to be deployed to hospitals to open much needed beds and ICU spaces. Currently, we have 1,167 staff that have been requested, and more than 75% of this staff have been deployed to hospitals and more current being placed daily. I want to share a couple slides to give an update on testing and vaccination efforts. If you look at our mobile testing site plan, you'll notice the site, and again, these are just state testing locations. There are lots of testing available in all parts of the state. The areas where we lack enough free testing availability, we have increased our testing opportunities. Again, if you want to schedule a test at any of the locations you see on the map, covidschedule.umc.edu is the way to get there. If we look at some of the numbers for those testing locations, the Capital City testing site, which is at the corner of Woodrow Wilson and West Street at the old farmers market, from April 2021 through August 2021, 24,228 PCR specimens were collected, 25,331 rapid antigen tests were performed. If you look at all the other state testing sites that I showed on the map from June 2021 through August 2021, 18,261 PCR specimens were collected and 21,178 rapid antigen tests were performed. Changes for the week: our Adams County Safe Room in Natchez has moved to 2 full days starting yesterday. George County has moved to 2 half days starting yesterday in front of the George County Health Department. In Greene County, 2 half days starting yesterday at the Greene County Health Department. Humphreys County Health Department is 2 half days as well. And then at Jackson County Health Department down in Pascagoula has now moved to 5 full days. Jones and Laurel at the County Health Department there is at 3 full days starting today, And Lafayette County Conference Center, this was a move from Lafayette County Health Department to the Conference Center. We're now there 5 full days starting yesterday. Just remember, anyone can be tested for COVID-19 free at any of these health department locations you saw on the map. Testing is encouraged for anyone who is symptomatic of COVID or if you've been exposed to someone with COVID, but anyone can be tested for free at those testing locations. Because of the high demand for testing that we still see in the state, please schedule an appointment ahead of time and provide some information to us about your symptoms. Again, you can make an appointment at the testing site, but same day appointments may not always be available. So please schedule your test at covidschedule.umc.edu or by calling 601-496-7200. If we look to vaccine, still a lot of activities going on, but a majority of our vaccination efforts here at the health department right now are through our health equity unit, as well as our community health centers and our COVID community vaccination partners. These are just some examples of the work for Pfizer first doses that the unit will be doing this week and going into next week in Vicksburg, Corinth, South Haven, a number of locations in Jackson and schools, as well as in Ridgeland and Pearl. Also additional Pfizer doses and some that are Pfizer and Moderna that will be offered in Meridian, Jackson, Columbus, Morton, Hattiesburg, Horn Lake, Vicksburg, Gulfport, Bolton, Houston, Greenville, Van Cleve, Starkville, and Columbia. And we have some second dose appointments coming up around the state in Houston, in Madison, Olive Branch, Morton, and Forest, down in Brookhaven, Moss Point, Jackson, Hattiesburg, Edwards, Pearl, and Indianola. Remember, free COVID vaccine is available at all county health departments in Mississippi during our normal days of operation. Again, schedule a free vaccination ahead of time so that you can receive quicker service, although same-day appointments may be available and usually are available. Third dose appointments are now available for those that are immunosuppressed, and appointments can be made at covidvaccine.umc.edu. Remember, if you're homebound and need assistance getting your COVID vaccine, send an email to the COVID homebound at msdh.ms.gov or call our hotline 7 a.m. to 7 p.m. 7 days a week at 877-978-6453. We're still looking to host events. As you saw, our Health Equity Unit and others are working diligently to continue to create opportunities for vaccination around the state. If you have someone who's interested in putting an event together, give us a call at the COVID hotline at 877-978-6453, or they can send an email to vaccineevent@msdh.ms.gov. Last part of my update is really kind of an update on Hurricane Ida impacts. Our initial damage assessments have been completed for healthcare facilities in the state. All our hospitals and long-term care facilities are now reporting they're back on commercial power. We did have initial reports of 4 hospitals and 3 nursing homes with minor structural damage. For our public water systems, as of this morning, 98% of all our systems are operational, with 6 current boil water notices affecting approximately 4,710 Mississippians, much improved from the briefing last week. Town of Eden in Yazoo County is on boil water, as well as the village of Glendora in Tallahatchie County, Sunny Hill Water Association in Pike County, Oak Harbor in Hancock County, Sunrise Mobile Home Park in Hancock County, and Wright's Campground in Franklin County. Remember, if you receive water from one of these systems under a boil water notice, that you should not drink tap water. Bring the water to a rolling boil for 1 minute to kill most organisms before consuming it.